hit badly by last month's strikes and industrial action. The UK's famed National Health Service, or the NHS, continues to struggle. A new survey says the UK's satisfaction with the NHS is at its lowest ever. A British social attitudes survey says only 29% of people are actually satisfied with the NHS. The biggest fall is for accident and emergency units in the NHS. The fall in overall satisfaction is seen across all ages, income groups, genders and supporters of different political parties. The findings also show that England, Scotland and Wales are missing their waiting time targets. But at the same time, around 43% support more funds for the NHS, even as 28% say the NHS should work within its budget. A report published earlier said the NHS in England needs a big push of domestic doctors, nurses and health workers to dodge a recruitment crisis. As per an internal document accessed by the Guardian newspaper, the NHS will face staff shortages of up to 571,000 personnel by 2036. Currently, the NHS in England is already operating with a shortage of 154,000 staff members. The document, which is under a ministerial review, aims to end the NHS understaffing crisis that's been hovering over the department for many years. The NHS also made some proposals to the government to achieve its target and win back public trust. Well, for more on this, our correspondent Alex Isaac joins us live from London. Alex, good to see you there. And of course, we've been hearing so much about the NHS in the news and the strikes and the industrial action. But now we're hearing, of course, from the people who live in the UK and just how disappointed and unsatisfied they are with the service they're receiving.
Yeah, absolutely. It does seem that what was already a problem before the COVID pandemic has reached huge raises now because people cannot get GP appointments. They have been told over and over not to go to A&E unless it's an emergency. They are getting problems with care as well. Now, we are an ageing society in general, but also going back to your other story with the refugees and asylum seekers as well, there are a lot of people within the UK and there's not enough infrastructure and there are not enough staff going out there to try and help people. Those NHS workers that have been on strike are asking for a pay rise. There's a discussion that's happening at the moment with their Health Secretary Steve Barclay about trying to ensure they get at least some kind of pay rise, and then it's a bit backdated, but that won't be until April. Overall, the budget that we saw Jeremy Hunt put out, there's only actually a 3.8% extra on funding going to the NHS. Now, when we compare that to other areas of funding, it really isn't getting that much. But if the workers don't want to work within the NHS, that's where the problem really lies. Because without enough staff, the people aren't getting support. And many people are spending so long on the telephone trying to get any kinds of appointments. Those appointments we saw through COVID and the pandemic that were pushed back in hospitals, there's a huge backlog. A&E waiting times are still going through the roof. There really is a real problem here, and it does seem that this has been going on for decades, but we're seeing it crumble before our eyes in this coming year. And it is a real problem for the average person who just wants to get an appointment. As I said, we are in an ageing society, so those people who haven't got phones or at least access to the internet, people are asked to go online and try and make appointments that way or have a phone call. And we keep hearing these obviously terrible stories where people aren't making those calls and they're really concerned about their own health. And now with the cost of living crisis as well, people are choosing potentially not to go to the doctors and get prescriptions, which then again will have another problem on the NHS. There is something that fundamentally is going wrong with it within the service, and whether or not that will be helped by any more funding. I think the Health Secretary Steve Barclay is currently, from what I know, is looking into it, and he is going to try and focus on how to fix this going forward. That's one of Rishi Sunak's 5 promises, so hopefully we will see some movement there.
Alex Isaac joining us live from London. Many thanks.